On January 3rd, Dr. Anthony Fauci talked about one of the worst health seasons in decades for the flu. You had to dig deep in the headlines to notice a story about a new virus in China. 3 days later, the World Health Organization announcing a mysterious pneumonia. Less than 2 weeks after that, President Trump weighed in as the U.S. recorded its first known COVID-19 case in Washington state.
We have it totally under control.
Warnings increased. On January 30th, the WHO declared a global health emergency. The next day, the president declared a public health emergency on paper while downplaying coronavirus in person.
Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
It did not. Schools and work went virtual. Weddings and get-togethers canceled. Grandparents unable to visit their grandchildren. Graduations, celebrations, and virtually all of life's moments meant to be shared were upended. Shoppers emptied shelves of toilet paper and hand sanitizer, while much of America labeled non-essential shut down.
The first week or two, there was basically no traffic. I think we were making $100 a day. So it went to nothing.
Unemployment surged. By May, 1 in 5 Americans had filed for unemployment benefits, and food bank lines stretched for miles. The Dow dropped 34% in a month, with its worst day ever, March 16th. And Congress rushed back to Washington to pass the largest emergency aid package in history, $2 trillion.
This will deliver urgently needed relief to our nation's families, workers, and businesses.
On April 28, the U.S. reached 1 million cases. By December, that number soared to nearly 15, with over 300,000 deaths. In between, a pandemic turned political. People in Michigan protested stay-at-home orders, and masks, or lack thereof, spoke volumes. Spring break, summer bike rallies, fall holiday travel, all happened. But Dr. Anthony Fauci warned things had to change.
We've got to hang together on this. We can make it turn around. We really can.
President Trump tested positive for COVID-19 in October, and after a weekend in the hospital, he said everyone should get the treatment he did.
You're going to get better. You're going to get better fast, just like I did. So again, a blessing in disguise. Good luck.
The government's $10 billion Operation Warp Speed program aimed to get 300 million doses of vaccine developed and delivered in record time. In November, the first promising results for vaccines. Pfizer reporting 95% effectiveness, Moderna 94%, with more companies still at work.
We can see the end of this pandemic. It's the beginning of the end.
Now questions of who gets vaccinated when, and how to care for surging numbers of patients in the meantime. I'm Camila Bernal reporting.